John Vaughn. I'm a resident of Stillwater, Minnesota. This is my OSI physical therapy success story. I injured my knee about a year ago. I was demoing an old house with a bunch of 21-year-olds trying to keep up with them. Didn't know when I actually heard it, but it started kind of tweaking on me during the night, and by the next day the thing had blown up to the size of a basketball. So I went into the doc, went 3 times. They recommended that I get surgery. I was not comfortable with that because once you have surgery, you take that option off the table for the future. I decided to try physical therapy, and I was very fortunate to go to the OSI location in Stillwater. And my physical therapist, Scott Forster, was he was a taskmaster, but he was also fun to work with. I did everything exactly how he told me to do it. I made sure that I was, conscious of how I walked and my posture, doing the exercises diligently, going in a couple times a week and having him work on me. What I had wrong with my knee is I had swollen or stretched a meniscus. There's another ligament that I can't pronounce the name of, but I had stretched that one out too. It runs kind of diagonally across my knee. And I had a deep bone contusion. I guess I had come pretty close to fracturing my tibia. So the whole thing added up to a lot of pain, but I was able to work through it. And over the period of the last year, due to just the great physical therapy I received at OSI, my knee's gotten better, and I'm looking forward to some snow falling here and getting back out on the trail and the cross-country skis if we can get some snow this year. So that was the short course on my physical therapy at OSI. But there's a couple more things I want to talk about. One is the environment. When I came there, I barely warmed my seat before I was taken into the back to receive services. They knew my name, first name, when I got there. They got me into a room. Everybody was very personable. Everybody is very aware of who's waiting and who's doing what. They seem to have the ability to multitask, get you in a room. They have this thing they put on your leg that contracts and expands, and it's cold. It feels wonderful. They put you on a bike. They get you to loosen up your knee, and then you work with a physical therapist. The environment in the large room where they actually do the physical therapy is very positive. It's informal. But it's a kind of informality where people conduct themselves professionally, but it's easygoing, it puts you at ease. I was very happy to be there. There's a lot of sports jerseys hanging on the wall. They've worked with some big-time names that you would all know. And I was just very happy with the environment. And it was consistent. I must have been there maybe 8-9 times, and every time it was the same. My favorite thing is that they expedite you to your therapy quickly, so they're respecting your time. There's a lot of healthcare agencies that do not respect your time. These folks absolutely respect your time. So I was pleased with both the therapy, of course, but also the whole environment and how I was treated. And I would not hesitate. I don't want to get hurt again, but I would not hesitate to go back to OSI. I've always been, kind of aware that eventually I'd have some problems with my knees. I've had incidents in the past that they've kind of healed up of their own volition. I always knew that there would be a decision to make involving surgery as I aged. I have been, not crazy about having surgery. Because one, it's invasive procedures. 2 is once you have it, you can't go back and have it again. It gets into kind of increasing grades of invasive procedures. So I've always wanted to find the least intrusive method to heal kind of these physical, challenges that happen every once in a while. And so that, I had everybody telling me. The doctor was telling me, my family was telling me, my friends were telling me, Everybody seems to have an opinion, and they all seem to get the surgery. And I decided not to do it, and I made the right decision, and I knew within 2 visits to OSI I could feel the improvement to my knee, the ability to stretch it, to fully extend it, and so I knew that things were going to get better, and I knew that if I stuck with the program and did the exercises and made my visits to OSI, that things would get better over time, and they have, and so I'm very happy about that. If you're on the fence between surgery and physical therapy, I would highly encourage you to contact OSI and to go in there and start that process of physical therapy. I hope that you'll have a similar result to me, and I think that I made a good decision, and I would encourage you to do the same.